Hello, everyone. My name is Sahib Singh. I'm a hospitalist at Sinai Hospital, Baltimore. Today, we are going to discuss a recently published paper in GIE Journal, which is Indirect Comparison of Various Types of Lumen-Apposing Metal Stents for EUS-guided biliary and gallbladder drainage. This is a systematic review and meta-analysis. I would like to thank my co-authors on this publication. As we all know, the main lumen-apposing metal stent available in the US currently is the Axio stent. The rest of the world has different types of stents available, which is the Spaxis stent and Nagy stent as well. The main difference is in the structure, as we can see in these images. As they describe, the edges on the Spaxis stent are more softer, leading to theoretical decrease in the rate of adverse events with the Spaxis stent. So in this study, we had pooled proportions separately for the Axios and Spaxis stent. For the Axios stent, we had 11 studies with 433 patients. For the Spaxis stent, we had 7 studies with 242 patients. As we can see, the rates of technical and clinical success for both of the stents are comparable. Even the total adverse events for EUS-guided biliary drainage were comparable. However, for the EUS-guided gallbladder drainage, the adverse events were 23.6% for the Axios stent and 9.5% for the Spaxis stent. So there could be some reasons for these differences in adverse events between the two types of stents. First is, as we discussed, softer edges in the Spaxis stent, which could lead to lesser bleeding. In this study, we had 1.8% risk of bleeding with the Spaxis compared to 4.8% with Axios stent. As the Spaxis stent is newer use in the clinical studies, the gastroenterologists may have accumulated experience with time. So the adverse events may be lower with the newer Spaxis stent compared to Axios stent, which has been in market for some time. The different number of studies may account for the difference in the results. And as we observed, most of the Spaxis studies actually use electrocautery enhanced lamps, as opposed to the cold lamps in some of the studies for the Axios stent previously. As we know, the electrocautery enhanced lamps has lesser risk of adverse events compared to without electrocautery inbuilt into it. There were definite limitations in our study. The observational studies included in this meta-analysis have the inherent risk of bias. The studies were very heterogeneous in their baseline characteristics. Some of the studies use coaxial plastic stents, which could have impacted the results. And the main limitation would be this is an indirect comparison. So we don't know the statistically significant adverse event difference between the two types of stents. So in conclusion, the Spaxis stent may be better for EUS-guided drainage, as we saw in this study, in terms of the lesser adverse events compared to Axios stent. However, we do need direct comparison studies, preferably randomized trials, to validate these findings. Thank you.